An interagency government group has urged employers to support the mental health of their workers during the COVID-19 pandemic. It added that disruptions and changes in work arrangements may result in workers feeling anxious, socially isolated and stressed. And to mitigate this, it suggests that employers keep their workers updated about their salary and leave arrangements during the suspension of work. The group also advises supervisors to check in with the staff on a weekly basis through video conferencing or phone calls. It suggests more flexible work schedules and regular breaks for parents of children in order to ensure that they can balance both duties effectively. Now, a list of external counselling services is also available for employees.
Now, even as the authorities urge employers to pay more attention to their staff's mental health, there could be a shortfall in the number of clinics or organizations that can provide such help. Psychological services are not listed as essential during the circuit breaker period, and only some have been allowed to continue having patients in person. The rest may continue, but digitally.
A counselling hotline by the Singapore Association for Mental Health has seen 50% more calls in the last 2 months than the usual. It says most involve stress and anxiety caused by financial uncertainty, as well as fear of being infected by COVID-19. As of the middle of this month, those who needed more in-depth help were able to visit only 66 psychological service providers. These had their exemptions request approved by the authorities.
For those who have been rejected, are they going to hold their clients that can't do telehelp, or can the clients then wait, a few weeks, who knows, right, to be able to be seen again? Some of these clients who are unstable or risky to self or towards others, and also will be unsuitable for telehealth in a sense where some of their diagnosis could be very difficult to access over a screen. So, for example, like if they're having a panic attack, over a screen, I wouldn't be able to be there to ground them or keep them safe.
Even as concerns mount over the mental health effects of the coronavirus, a psychologist worries about those not in this category, like those with developmental disorders such as autism.
Some of them cannot actually sit there and actually talk to me just over the screen as well. So it's just like a few days back when I had when I did one of the teleconference with them, and the client actually just showed me a blank wall. He is listening and talking to me, but he just can't face it. So without all the non-verbals, I just can't observe that at all.
The Health Ministry says the emphasis on teleconsultation is down to heightened safe distancing measures and is meant to reduce the risk of COVID-19 infections. But in allowing exemptions, it says it recognizes that such consults may not be appropriate for all types of conditions. The authorities have also published resources to help tide people through difficult times. These include virtual charts and helplines manned by the Institute of Mental Health and other welfare organizations. Nominated MP Anthea Ong, who has championed mental health issues in Parliament, says more needs to be done, especially if new disorders are diagnosed and existing ones are aggravated.
Psychological treatment should be part of essential services. And then MOH could issue a very clear and strict advisory to all the psychologists and psychological practices to exercise their professional judgment. If a client or a case warrants a face-to-face consultation. So by doing so, I feel we are then first and foremost recognizing that mental health is a priority.